Okay, so without further ado, I'll get started, inshallah. So, good evening, everyone. Welcome to the first installment of our International Pathway webinar series, where we welcome and we explore different medical residency pathways across different nations. Today, our journey begins with Qatar, a nation known for its rich culture, rapidly advancing healthcare system, and commitment to medical innovation. Qatar's healthcare infrastructure, particularly Hamad Medical Corporation, has grown into a regional hub for medical training and research, making it an ideal destination for aspiring medical professionals. Our esteemed speaker for this session is Dr. Ilyas Mustafa, a PGY2 internal medicine resident at Hamad Medical Corporation. Dr. Mustafa is a 2018 graduate from Sulaiman Alrajhi University in Saudi Arabia, and he brings with him first-hand knowledge and experience in navigating the residency landscape in Qatar. He'll be sharing invaluable insights into the challenges and opportunities that come with pursuing medical residency in this dynamic nation. Without further ado, Dr. Mustafa, the mic is yours.
Thank you so much. And I hope that everyone will enjoy and benefit from our webinar. So thank you for introducing me. As mentioned, I am currently a PGY2 internal medicine resident at Hamad Medical Corporation. I graduated from Sulaiman Alrajhi University in 2018. I did my internship in King Fahd Medical City in Riyadh, Saudi Arabia. After internship, I worked for 1 year as a GP in an outpatient clinic also in Riyadh, Saudi Arabia. Then I moved to Dr. Sulaiman Al Hospital in Qasim, Buraidah, in which I worked as an internal medicine resident, which is a non-training job, for 3 years. After that, or during that period, I was working on my future residency. And among the things that I successfully landed is the internal medicine residency at Hamad Medical Corporation. So I applied in the year 2022 for the 2023 starting program. I joined HMC using the following exams. For the English exam, I took the OET, and the clinical exam, I took the IFOM clinical knowledge exam. I will talk more about these exams in the future slides. In addition to my journey at HMC, I also obtained GMC registration for the UK by the lab route. So let's start by talking about Hamad Medical Corporation. Hamad Medical Corporation is the main healthcare provider institute in Qatar, which manages and directs multiple hospitals, including Hamad General Hospital, which is the main hospital that we are working in. There are different hospitals as well, a total of 15 hospitals actually. Some of them are tertiary hospitals, some of them are secondary hospitals. All of them are under the umbrella of Hamad Medical Corporation. So joining Hamad Medical Corporation can either be joining the institute itself, and they can rotate you through different hospitals, or for jobs later on after residency, you can join a specific hospital. But if you enter residency to Hamad Medical Corporation, in general, you will rotate in different hospitals under the same umbrella. You cannot apply to different hospitals in Qatar except through Hamad Medical Corporation and Sidra, which we'll talk about in the next slide. Hamad Medical Corporation has most of the hospitals in Hamad are JCI accredited. JCI is an international accreditation for hospitals, which makes working at Hamad Medical Corporation something that can enhance your CV and portfolio in general, if you are looking for an international career. In 2023, Hamad Medical Corporation had 4 hospitals ranked among the world's top 250 academic medical institutes, and 2 of them achieved among the top 100. The Hamad Medical Corporation is the first hospital system in the Middle East to achieve an institutional accreditation from the ACGMEI International. ACGMI International is something that you may frequently hear about in this presentation. It basically means that whatever standards that we have at the residency programs are the same as or similar to the standards that are being applied in the US residency programs. This accreditation gives an idea about the standards of the program. However, it does not lead to American board or something like that. So you will have the same protecting rules that protect residents in the US. And in the same time, you will have the recognition that the program Hamad Medical Corporation provides meets the standards of the US program. It can help in the application process for people who are pursuing the US route if you worked in Hamad, but it does not guarantee or does not give any specific boards regarding that. The healthcare structure for working in Hamad starts with the medical student. We have two universities teaching medicine in Qatar. We have Qatar University and Will Cornell Medicine, Qatar. Both of them have medical students and interns rotate with us. There are also international interns that come from different places. However, the internship program at Hamad, one of the requirements is that you have to have residency in Qatar before getting the internship. Residency, I mean Iqama or being a resident in the country of Qatar, not residency training. Then we have the residency programs. This is generally 4 to 6 years. You start by being a junior resident and then a senior resident. This is important for some of the hierarchy in the teams. However, at some teams you are, even if you are junior, you don't have any senior resident. You only have the fellow and specialist. After residency, there is the period of fellowship. We have different fellowship programs under different specialties. Generally, fellowship in Hamad Medical Corporation is 3 to 4 years. Then you can become a specialist and progress to become an associate consultant and in the future senior consultant, inshallah. You can join the program through different points. So you can join as an intern and that's it. You can join as a resident and you can finish residency and go, or you can finish residency and become a fellow. You can join as a fellow for some programs, but mostly fellowship acceptance is prioritized to Hamad graduates. But if there is any, if there are any seats available after accepting Hamad graduates, then they accept fellows. The acceptance for fellowship is direct. There is no online application. The people apply directly. You can also join as a specialist or as a consultant if you have already any postgraduate specialty. However, this is not the focus of our presentation. The focus will be about the residency programs. So regarding the residency training at Hamad, we have 22 residency programs, out of which 19 are ACGMEI accredited. I think the other programs, they are still working on getting the accreditation. However, most of the programs will maintain similar standards. The duration, as I mentioned, is 4 to 6 years. For medical specialties, it is 4 years, like internal medicine, pediatrics, family medicine. For surgical specialties, the majority of them are 5 years, except for neurosurgery, plastic surgery, and cardiothoracic surgery, which are 6 years in duration. By the end of your residency, you will earn the Arab board of the specialty that you got the residency in, as well as the Qatari board. Of course, after completing the exams for each of the boards. Qatari boards, of course, they will help you in working in Qatar, and maybe in the future, they will get recognized outside Qatar. They are new, just started a few years back. However, the Arab board is very well recognized. and you can work by your Arab board in different countries, including most of the countries of the Arab world, including the Gulf countries. Upon completing the residency, as I mentioned, you can match into a fellowship, which is having a very good acceptance rate for the graduates of Hamad. And there are some fellowships in some specialties that are 1 year, but the majority of fellowship programs are 3 years in duration, with some extending to 4. I just wanted to clarify regarding the categories of applicants, because this will be talked about in the application dates and application process. So there are 3 different categories for applicants applying to residency. We have category 1 applicants. 1A would be graduates of Qatar universities, both Qatari and non-Qatari nationals. And category 1B is for Qatari nationals graduated from outside Qatar. For the majority of you, it's going to be category 2, which is the non-Qatari international medical graduates. They do accept non-Qatari IMGs. However, the competition is high and it is increasing year by year. This category system applies to Hamad Medical Corporation. However, in Sidra, as we will talk in the next slide, it does not apply. So before 2024, all the residencies were directed by Hamad Medical Corporation. However, in 2024, going forward, the pediatrics residency program is no longer being provided by Hamad Medical Corporation and is now under the complete management of Sidra Medicine, which is the leading healthcare institute caring for pediatrics in Qatar. There is no pediatrics hospital under HMC. I mean, most of the pediatric diseases are treated by Sidra and pediatric patients. Therefore, the pediatric residency was shifted to Sidra Medicine. The application process is now separate. HMC application has its own rules and timings, and Sidra application has its own rules and timings. The benefits in general for residents are similar, but they may differ between the 2 institutes, especially with the progress of time. As I mentioned, also the acceptance and the way of application for international medical graduates are separate. They may get similar in the future, but for now they are there are some differences between them. Since we mentioned Hamad and Sidra, the question arises, can we apply for both programs? Yes, you can apply for now. However, you have to choose your priorities. So you have to choose your priorities. I heard of people being accepted in both programs. So for now, I would say you can apply for both. Okay, so these are the available residency programs with the seats for each program. So there are 2 columns. The first one, this one here, this is the maximum seats available for all the programs, including all applicants. The second one is the maximum seats available for international medical graduates in the last year's application. This does not apply to every year. It does not apply to this year in particular. It may increase, it may decrease, depending on the availability and application from the local graduates. So basically what happens is they open the application process for category 1 applicants before they open for category 2. Once they accept or do the interviews for the category 1 applicants, then they will announce the seats remaining for IMGs, and then next day the application process will open. So as we can see that the top programs in terms of number of seats available is internal medicine. We also have emergency medicine and family medicine, as well as pediatrics. Pediatrics might not be written here because now they are not announcing the seats. However, previously, when pediatrics programs were under Hamad Medical Corporation, they had 25 seats for pediatric residency. There is no separate seats for international and local graduates. So applying to SIDRA for pediatrics is as I mentioned, different. And it doesn't differentiate between the two. They have the same window to apply for each one. And it's although it might be bigger chance for local graduates, but we do have an acceptance for international medical graduates, which is significant. For these specialties that they say none, it's as I mentioned, don't be discouraged if your specialty of choice is among these. It may change each year, and for some people, I heard that you can apply, I think, but most likely the seats will be reserved for the category 1 applicants. There are some specialties I heard that some people got accepted when they applied, especially in neurology, but this is not guaranteed and may not be open every year. So let's talk about the advantages and disadvantages of residency at Hamad Medical Corporation. First, the advantages, as I mentioned earlier, most of the programs are ACGME accredited. This will help both in maintaining the standards as well as the recognition for the program if you want to pursue other countries later on after you finish residency. We have a good learning environment as well as good learning outcomes. We have a variety of cases that you may not be able to see in other places, including the US and UK programs. As you know, in Qatar, we have a diverse population of nationals and non-nationals. We have a lot of expatriates, and in Hamad Medical Corporation, we treat all of the residents in Qatar, regardless being national or not national. So we see a lot of rare diseases. A lot of the expatriates that come from outside countries may have genetic differences, or they may have some of the infectious diseases that we don't usually see in developed countries. So this is an advantage. You'll be exposed to more broad category of diseases, as well as the hand-on practice that we get to do in examining patients, doing procedures, etc. In general, our programs are encouraging research and quality improvement, and they do support, including supporting in the process itself, mentorship, as well as financial support for research and publication as well. We also have the availability of fellowship programs after residency with very good acceptance rates so far for graduates from Hamad Medical Corporation. And completing your residency at Hamad Medical Corporation will enhance your opportunity to pursue the US route. Last year, in internal medicine, the majority of PGY4s who completed residency got accepted in the US. When I talk about acceptance in the US, most of them would be accepted in residency in internal medicine. Some of them do apply to fellowships. However, applying to fellowship in the US after residency from outside the US will not grant you will not grant you, of course, the American board in the main specialty, and therefore you may not be able to work in the United States after your fellowship. Also in the UK, it can help. It's not like the US. However, we have a lot of consultants who have a background from the US or the UK, and they can give you connections and recommendations and enhance your reach to people in these countries. Among the other advantages is that you can work at HMC after fellowship. This, of course, decreases by time when more and more people graduate. However, we have a lot of our consultants actually have done their residency and fellowship in Hamad Medical Corporation, and they are at the level of consultant, senior consultant, and associate consultant. So it's there, it is possible. of course, if you work on yourself and if you prefer to stay in Qatar after you finish. We have a diverse environment, including consultants and colleagues. You will have different nationalities, different backgrounds, different experiences from each one. Like also, you will have uh, people who are fresh graduates in your batch, people who are older, like myself. So it's going to be an enriching experience when working with your colleagues and consultants. The residency programs and fellowship programs in Hamad Medical Corporation are very well paid. I think that we have, or we rank among the top paid residency programs for non-nationals in the world, excluding tax, of course, in the other countries. Yeah, it's paid very well, which is a good thing. In addition, Hamad Medical Corporation would provide a good health care for you, your spouse, and your children, if God forbid you needed anything, or in general, if you needed health maintenance, preventive medicine, etc. Although the workload can be high in our programs, it is not as tough as some other places. Well, I can say that it's not as tough as the majority of Arab countries, excluding the Gulf region. And in some of the US programs and UK, of course, UK is tougher, I believe, but US programs, some of the programs are tougher, some of the programs are lighter. So I would say it aligns with some of the programs in the US. And if you know about the residency in Saudi Arabia, I think the workload can be similar in some of the hospitals in Saudi Arabia. Of course, you will have more tough residencies in Saudi Arabia compared to ours in terms of workload. Qatar is an excellent country to live in. So it's actually a Muslim country, and working and living in a Muslim country will grant you respect to your religious and cultural practices, which you may not see in the West. So this is one of the compelling reasons that people pursue residency in Arabic or Muslim countries in general. And if this country provides good training with excellent pay, this is going to be an excellent choice. For those who prefer the environment of Saudi Arabia, Qatar is very similar in terms of culture and environment and weather. So you will not feel a lot of difference when you move countries, unlike if you move, for example, to the US or UK, in which you will have different weather, different environment, different culture, different people. So it's going to be, if you go to if it's not going to be a culture shock when you move to Qatar, inshallah. These are the major advantages for residency programs in Qatar. The disadvantages, the most important disadvantage for me is that programs are highly competitive and they are getting more and more competitive every year. As I showed in the previous slide, the number of seats for international medical graduates is limited. Unfortunately, the limitation increases every year. For now, it may change, so don't be discouraged. But for example, when I applied to residency, the seats that were available for internal medicine program for international medical graduates like myself were 35. The last year, as I mentioned, were 14. So this will give you an idea about how competitive the programs are. There are lots of applicants, especially for specialties that have limited seats, like surgical specialties or emergency medicine. So the most number of seats for IMGs will be for internal medicine and for pediatrics if you apply to Sidra. As I mentioned, don't be discouraged, even though the seats were very limited. I know two from my university last year after me who were matched in the programs. So you can get one of them was accepted in internal medicine, the other was accepted in pediatrics. Even for the surgical specialties, in my batch, there is one colleague from my university, from my batch, who was accepted in plastic surgery, which is a very very, very competitive program in the world, not only in Qatar, even for nationals. So although it can be competitive, if you have the right portfolio, the right experience, the right application, you can have the opportunity to match into the residency. The second disadvantage is for people who are seeking the outcome. For example, the US or UK, the outcome in the residency in Hamad Medical Corporation might not be optimal for you. So as I mentioned earlier, the outcome for residency is Arab board and Qatari board. And for fellowship as well, it is Arab board, unlike the American board or UK CCT or CCST. The third disadvantage is that for people who are pursuing getting the passport of the country that you are moving to, which can contribute to a lot of people, you will not have any progress towards getting the passport or nationality other than your nationality. Unlike, for example, the UK, which is easier to get the passport within 5-6 years, and other countries as well. The last disadvantage from my side is that not all fellowship programs after residency are accredited. Some of the fellowship programs are not ACGMI accredited. They are working on it. It may get accredited in the future. And not all of the fellowships as well have the Arab board. So you may want to choose the fellowship program after residency wisely, depending on the accreditation for each fellowship. However, this is a next step after residency. Of course, you have different routes after residency, so it depends on what you want. This might be and might not be a very important disadvantage. For a lot of you who have family in Saudi Arabia or want to go back to Saudi Arabia after you complete residency or fellowship, you will ask yourself, how does my board rank in the Saudi Council for Health Specialties in Saudi Arabia? So before I started residency, I sent an email to the Saudi Council for Health Specialties regarding this point. And at that time, they told me that it is the Arab board outcome from Hamad Medical Corporation would be in the second group, in which you can become senior registrar after you graduate immediately. And after 5 years of experience, you can become a consultant in Saudi Arabia. Regarding the Qatari board, because it's a new board, it is still not it's not categorized in Saudi Arabia. However, if you want to pursue with the Qatari board, you can request studying your program, and then they will rank it depending on the standards that they have. However, I don't think that it's going to be more than the category 2. Recently, also, the Arab Board for Health Specialties published that the Saudi Council for Health Specialties increased the rank for Arab Board to the second group, as mentioned in this email. However, previously there was some specification that the training must be under the Arab Board in first group countries, which is not clear for a lot of people. However, after this announcement from the Arab Board, they changed this into general. If you have the Arab board, it's category 2. That's it. So let's say that you are convinced now you want to apply to Hamad Medical Corporation or for residency in Qatar. What is the timeline that you expect? So the application for Hamad Medical Corporation starts in the 1st of August until the 30th of September. This is for category 1 and category 1 applicants in general. After that, they will do some interviews and ranking for these applicants. And then they, on 24th of October, they will announce how many seats are available for each residency program. On 25th of October until 30th of November, the window will open for international medical graduates to apply to Hamad Medical Corporation residency programs. This date is important when you want to plan your exams, you want to know the deadlines so that you can apply. Of course, for this year's application for next year program, you can still apply if you have the exams. If you don't have the exams, it depends. If you have one exam, you may, if you have the iPhone, for example, USMLE, and you are missing the OET only, you can apply. However, if you need both exams still, you cannot apply this year, unfortunately. For Sidra Medicine, for this year's intake, the window will close today. So if you are ready, you can apply. Best of luck. I'm not sure if the deadline finished or not, to be honest. Maybe it's finished already. So best of luck in the coming years, inshallah, if you want to apply to Sidra Medicine. As mentioned, for Sidra Medicine for now, it is one application for both applicants. There is no category 1 or category 2. It may change in the future. And also, as you know, that these dates are for this year's intake, this year's application, sorry. So for next year, it might be different. It is very important to update yourself about the dates if you are pursuing this route. For the eligibility requirements to apply to Hamad Medical Corporation, first, you need to be a graduate within the past 6 years, and the graduation date is counted as the final medical school exams, not your internship. It is your MBBS certificate date. Usually in Saudi Arabia, they write the date clearly. So for application in this year, the maximum graduation year will be 2019. So if anyone graduated in 2018, for this year, unfortunately, they cannot apply. Next year is going to be 2020, and so on. So each year you will increase by 1 year. So there are 6 years before the joining date. In Sidra, it is 5 years. For pediatrics, it is 5 years, not 6 years. So it is a little bit less. The second, regarding your college, it needs to be listed in the World Directory of Medical Schools. The majority of Saudi Arabia universities, including Al Ma'rifa, are listed. We have residents from Al Ma'rifa University in the internal medicine program. I'm not sure about the other programs, but I know at least 2 from graduates from Al Ma'rifa. Both of them have finished the internal medicine residency last year. The second point in eligibility requirements, you need to complete, of course, your internship. You need to have a certificate of completion of internship. This is usually provided by your college. Some countries and some places, it is provided by the Ministry of Health. But as far as I know, at least for my university, they provided us with the certificate for internship. I believe yours as well do that. Make sure this is something that you acquire. Some people who choose to do the internship outside, this might be different. So make sure the internship certificate that you will get is applicable. You need to hold a valid medical license or be eligible for license in Qatar. This is for people who graduated already. I believe that it is very wise to get your Saudi Council for Health Specialties license as soon as possible once you complete your paperwork from university after graduation, of course, after completing the internship. You can still apply if you are an intern and your internship will finish before the 1st of July in the program start date. So the program, if you apply in this period, it's going to be for next year, 1st of July starting date. So if your internship will finish before next year, 1st of July, you can still apply. However, the majority of people who were accepted, at least from Saudi Arabia, what I know is that they finished internship and then they applied. So depending on your circumstances, you can still choose to apply. However, the exams will have validity. So you may lose the validity if you apply earlier. Then you need to be in continuous medical practice in the year preceding your application if you have graduated already, with no practice gaps of 1 year or more. So if you are pursuing residency in Hamad Medical Corporation or in Qatar in general, And even in the majority of countries, working or work gaps are discouraged, and they may affect your application. For Qatar, they mentioned maximum gap after internship, and to the application of the program is 1 year gap. So, for example, if you work after your graduation, this is fine. For people who graduate and they don't have immediately after graduation a residency program or any practice of clinical practice, I mean, it may affect. So for people who choose to do, for example, research fellowships, make sure not to exceed 1 year gap after your graduation until you apply. So at least try to have some clinical work. This is very important. It is an excluding point if you have a year gap. Of course, for some people who have special circumstances, they can justify. However, I would say this most likely would be for local graduates. For international graduates, I believe that they are sticking with these requirements. For some programs, they require that the applicant can speak Arabic fluently. This includes internal medicine, neurology, family medicine, psychiatry, and urology. You don't have to be, maintaining a dialect in Arabic or something like that. At least if you can converse with people, mainly for patients, then you can apply. Of course, you can still apply. I know some people who are with us, including my year and the New Year's, whom their Arabic language is not excellent. But in the website, they mentioned this as a requirement. You need to pass one clinical exam and also an English exam. We will talk about it in the next slide. So for the clinical knowledge exam, they accept 3 exams: USMLE Step 2, CK, IFOM, CSE, and MCCQE Part 1, which is the Canadian exam. So this is the US exam, this is the Canadian exam, and IFOM is similar to USMLE Step 2 CK. However, it's not, it's generally done for medical students and medical graduates for residency application. It is shorter, and I will talk about it in details in the next slide. The minimum score for each exam, USMLE Step 2 CK is 214. IFOM CSE is 74. This is the minimum to apply, not to get accepted. And for the Canadian exam, you need to pass the exam. So the mark is a very important parameter for acceptance. Getting 74 or 75 will not get any, I believe, will not work for acceptance for international medical graduates. However, this is the minimum requirement that you can apply. If you get this score and you don't have time to repeat the exam, should you apply? You can apply. It depends, but I would not apply with not a good score. Improve your score and then apply. For the English exam, before English exam, the validity for these exams, it depends on the exam. There are some exams that this is not something that is clearly mentioned in the application website. For the clinical knowledge exam, they mentioned that it needs to be verifiable on the exam website. For IFOM, the exam result will stay for 2 years after your results. So after 2 years, after the IFOM, the result will disappear, and therefore it's not going to be verifiable on the website, and it will be deemed invalid for application to Qatar. USMLE, I think it is 7 years, I'm not sure. But as long as your exam is valid by the exam center, it is valid for application. This is different to the English exam. So for the English exam, it is valid for 2 years, and it must be valid at the time of application. If it expires after the time of application before joining date, you may still apply using it. However, I encourage that you have a recent exam, at least like a few months after the application period. For the accepted exams, we have the occupational English test. The minimum score is 350. The scoring system for OET is by section, so you'll score a certain score in reading, writing, listening, and speaking. They don't give an average score from the exam itself. However, the requirement in Hamad Medical Corporation, you will combine the scores and divide them by four, sorry. This will be equivalent to B in each section. However, in some countries, for example, if you get B in the reading part and A in the writing and C in the listening, for example, you will not be able to apply. However, in Hamad Medical Corporation, you can still apply if your average score is more than 350, regardless of the individual sections. For the IELTS, they need the academic version of the exam, and the minimum score is 7. For TOEFL PBT, it is 60 for Hamad Medical Corporation and 50 for Sidra. And for TOEFL IBT, they require the professional version of the exam, and the minimum score is 87. The score in the English exam is, if you get the minimum requirement, that's, I think, gonna be enough. They don't focus on the mark for acceptance in residency. It can be a differentiating factor, like if your English is very, very good, it may increase your rank. However, I don't think it's a major point in your application. So a few points about the OET and IFOM, since these are the exams that I did to enter residency in Qatar. For occupational English test, the medicine version, the fee is 587 Australian dollars. This is equivalent to 1,485 Saudi riyals. They offer on-paper and computer tests at a venue. There is a home version. I'm not sure if they are doing it for outside the US. However, you can, according to the last year's application, you can still apply using the home OET test. For me, I did the on-paper test. However, if you it depends on your circumstances and your capabilities, you can choose the on-paper and computer test, whatever you want. The exam is offered frequently. For the paper test, it is offered twice per month. The seats might be limited, so you want to apply early. For the computer test, it is almost given daily. However, you need to book it 1 week in advance for the computer test and at least 24 days in advance for the paper test. The duration of the exam is 2 hours and 45 minutes. There are 4 sections. The listening section is 40 minutes. There are 42 questions on 3 parts. The reading part is 60 minutes, 42 questions divided in 3 parts. The writing section, you have 45 minutes to complete 1 task. This task is usually a referral letter or a discharge summary. For the speaking part, you have 20 minutes to interact with the examiner. There are 2 role plays that you need to complete. The results will be announced within 17 days for the on-paper test and within 10 days of the computer test. For this, it is, I think, sharp, 17 days and 10 days. It's not going to be released before this date. So minimum 17 days, minimum 10 days. This is important to plan your application timing wisely. For the preparation, there are multiple online courses for the occupational English test. The one I used, and I do recommend, actually, it's a good platform, is E2 Language. The E2 Language, they have online sessions, videos, questions, mock exam, etc. And the most important point in preparation for the occupational English test is practice. I don't encourage going for the exam without practice. I don't encourage going to the exam without an online course because it's gonna give you the idea, even if your English is very good, it's gonna give you an idea on what are the tasks. If your English is really, really good, timing will be a very important factor. So you will have a very strict time for listening, very strict time for reading. So you need to practice the exam style questions, even if your English is good. For the IFOM, the IFOM exam is the clinical knowledge exam that I did. The fees for the exam are $300, which is equivalent to 1,125 Saudi riyals. It's a computer-based exam, very similar to the USMLE Step 2 CK. It is offered only 2 times per year. So you can only apply 2 times per year. The application period is as the following. So they have two windows for the exam. The first window will be for an examination, focus on today's. The examination window, it starts from 20th of March until 27th of May. So this is the period where you can do your exam. The second window will be between 21 of August and the 4th of November. This is the period where you can do the exam, but the application will start earlier and it will close earlier. So for example, if you want to take the exam in May, you need to apply in January. And they will need verification from your university. This verification needs to be done before, for example, in the first window before the 29th of April, and for the second window application in July, and the application will close in the 31st of July. So for this year, the application is already closed. You cannot apply for this year, although the exams are still running. They are running until the 4th of November. If you didn't apply yet, unfortunately, you cannot apply. You can apply for next year's first window, which is it starts the examination in March, and the window will be the registration will start in January. You can use both windows to apply for next year's application. So if you want to apply next year to enter residency in the year after that, you can do both times. You have two opportunities to do. The first one, if you get the good mark, that's it. If you didn't get, you can still use the second window. Although the exam window is between March and May, for example, and August and November, you can only take the exam in one window one time. So if you apply for window 1, you can only take it once, whatever date you choose between March 20 and May 27. The same for window number 2. The duration of the exam is 4.5 hours. Actually, for actual time to solve questions, it's 4 hours. So it's going to be around 1.5 minutes per question. You have 160 questions divided on 2 blocks. Each block is 80 questions. The results will typically take 1 week after the exam date, not after the window. If you get the exam on 20th of March, most likely by 27th of March you will get it. However, in the exam website, they mentioned that it may take up to 4 weeks to get the results. So if you are short of time for the application, you may want to consider getting your exam earlier. However, I did the exam twice, and in both times I had the results in around 4-5 days maximum. It's not guaranteed. However, most likely, most people I know who took the exam, the results will appear very soon. This is an advantage for the exam compared to other exams. The content of this exam is very, very similar to the USMLE Step 2 CK. However, the questions are shorter. In general, it is an easier exam. So if you are well prepared for the USMLE Step 2 CK, I believe you can crush this exam with ease. For the preparation for this exam, it is the same preparation for USMLE Step 2 CK. I would prepare as if I'm going to the Step 2 CK and then do the iPhone. You will get an excellent mark, even better than the Step 2 CK mark. So for the preparation, there are 3 resources, or 3 categories of resources. First, you need a question bank. This is 100% required. I believe whenever you do a clinical exam, do a question bank for this exam. It's very, very, very important. I would advise personally to go for UWorld USMLE Step 2 CK question bank. Finish it. If you finish UWorld with studying the explanation for each question and why each answer is wrong, I believe that's going to be more than enough for the iPhone. It is a very good resource. I would advise to get the paid version. I know it is expensive. Maybe it's at least more than the fees of the iPhone CSE. However, I would advise to do it. If you already have it available somewhere, that's going to be fine. But the platform of UWorld is very, very similar to the platform of the real exam. So you will be able to do the exam in a very effective way. The second thing is you can do timed studying, timed questioning. Each question that you solve will give you that you solved it in 30 seconds, 40 seconds. So because the exam in general for IFOM or USMLE Step 2, you need to be very fast in solving the questions. And in your practice, you need to practice in a timed fashion. So it's going to help you in that. If you, there is another resource. Some universities, I'm not sure about your university, provide free access to AMBOS. It is a good resource. For me, it is not as good as the UWorld. However, I know people who got very good marks in IFOM only using preparation from AMBOS. I'm talking about 90 plus. So you can still do AMBOS if you have free access to it. However, if you are, and it is cheaper, I think, than UWorld. If you are paying anyhow, I would say go for UWorld, except if you are, if you already have a free version of AMBOS. Yeah. For if you are a type of person that you want a structured learning, like you want a book or you want a course, then doing the question bank first would not be ideal. Because in the question bank the questions will get random. You will get you can choose, for example, cardiology questions, but they will not give you, for example, cardiology, valve diseases, then acute coronary artery disease. Then no, you will get the questions randomly. One question will be about coronary artery disease, next maybe about lower limb ischemia, whatever. Because if you get the questions in systematic manner, then you will solve the question. This question about aortic stenosis, next one will be aortic regurg. You get a question about mitral stenosis, so it's not going to be effective. If you need a book, I would suggest Master the Boards for USMLE Step 2 CK. It's a very good book. I used this book in my preparation as well. I didn't complete the book, but I took it as a guidance for topics that I needed to review and to structure my learning in general. I did also the world's question bank. So the third category is videos. If you are a student who prefers to do videos only, you will benefit a lot from online med-ed. It is a very good resource. It used to be free. Unfortunately, now it is paid. Some people may have access to that. I don't promote it, but I do promote online med-ed, but I don't promote getting access without payment. For me, to be honest, I did also online med-ed. It was free at that time. But I think it is expensive as well. I think it's for a yearly subscription, it is $365. It is expensive. I don't think it is as it's cost effective, to be honest, unless you are in need to do videos. I know that I sound maybe promoting for these platforms. However, they help me a lot. And I did UWorld Question Bank. I didn't complete it, but I did the majority of it. I did master the boards for some topics. I did online with it as well. They helped me a lot in the preparation. So how to choose your exam? Let's start with the English exam. This is straightforward. I would say go for OET, unless you have a compelling reason to do another exam, or if you already have another exam in hand. If you know, for example, that you did IELTS and you did great, you did 7.5, 8, previously you want to repeat it, it's easy to you to prepare, then go for it. Otherwise, if you are starting to prepare for an exam, go for OET. It's easier. Its content is only in medicine, and it's gonna be like directed for you as a doctor. So it's gonna be easier to do the exam, especially if your language is mainly in the field of medicine. If your language is strong in the field of medicine, I would do the OET. That's it. This is my advice. This is what I went for. Unless, as I said, if you have another exam, or you have, for example, an exam if you are doing this to help in preparation for another residency, and they only accept another exam that is accepted in Qatar, you can do one for both countries, that's fine. But I would go for OET, unless, as I mentioned. For the clinical exam, if you don't intend to apply to the US residency program, I would advise you to go to the IFOM, straightforward, no questions asked. Why? Easier, shorter, less expensive, etc. If you intend to apply to the US residency match and you want to fight for it, go for the USMLE Step 2 CK. However, if you have, if you plan to apply one day to the US, you are not very well prepared to take the USMLE Step 2 yet, and you want to apply to Qatar first to try then you can go for the IFOM. I believe that you will get a better score in the IFOM compared to USMLE Step 2. So it depends on your circumstances. As I mentioned, the IFOM is shorter, cheaper. It needs a less time for preparation. It is more likely that you get a higher mark. And another important point is it is very short to get your results if you use the IFOM. So if you are short of time and you are afraid that you will not get the exam results before the application window closes, go for the IFOM CSE. However, as mentioned, the IFOM is done only twice per year. You need to catch it in the application period. When we talk about the exams, a lot of people would ask, do the choice of exams matter in terms of acceptance? There are some rumors that if you apply for USMLE using the USMLE, you will have a higher acceptance rate. Some people would say no. If you apply using the IFOM, it's going to be more likely that they will accept you. I don't think that's true, regardless of the exams. I think the mark is more important than the choice of exam. If you apply using USMLE Step 2 in a higher grade compared to IFOM CSE, then you are more likely going to be accepted with the higher rank. However, it is very important to know that Hamad Medical Corporation don't like people who are pursuing the US route actively, because they are afraid that you will exit the program if you get accepted in the US. Doing both USMLE Step 1 and Step 2, and if you have, like, for example, in your CV, you did a rotation in the US, I don't advise to show that in your CV a lot, because it may discourage the programs from accepting you if they know you want to go to the US. To go to the US before finishing residency. Of course, after finishing the residency, you can go to the US. They will help and support you in doing that. However, the most important point that they hate is leaving the program after 1 year, 2 years, and going to the US. And even there's actually a penalty for that. You will have to pay back Hamad Medical Corporation 30% of whatever they paid you if you want to leave before completing your residency. So, for example, if you apply to Hamad, you are accepted, you finished PGY1, you were accepted in the US, and you want to leave, you will have to pay 30% of your salary for 1 year in order to be legally exiting the program and ending your contract with Hamad Medical Corporation. The other point is, do USMLE Step 1 and IFOM basic knowledge exam help in application? Some people say yes, some people say no. I don't find a compelling reason to do IFOM basic science exam. If you are pursuing the US route, you may do the Step 1 exam, but I don't think it's gonna help in the application, although you can upload your results if you have IFOM BSE or USMLE Step 1 in the application process. So you can use it as a point. If you have the IFOM basic science exam, maybe upload it. If you have Step 1, I don't think that's gonna be wise to do that. For your application, there are different requirements or required documents. This will include, of course, your MBBS certificate or MD certificate, the graduation certificate itself. You will need the academic transcript, internship certificate, the medical license, if you have it. You need an evidence of clinical practice if you are already working or you are doing something after internship. So if you finished internship, you started working in a GP or in a hospital, non-training job, you need an evidence of clinical practice. This needs to be official from the hospital you are working in or the clinic you are working in. They will not accept anything else. For the English language test, you need the certificate before the application date, of course. Before the application, you can do, for example, the window starts in 25th of October. If you get your OET and closes by the end of November. So if you get your results in like 1st of November, it's fine, you can use it. However, for your application, you need to have the result for both English language test and the clinical knowledge test. You need to have a valid passport. You need to have to upload also a CV. You need to write a letter of intent or a personal statement. This is similar to the one that they use in applying to the US. So if you want guidance on writing the letter of intent, you can search for how to write a personal statement for US residency programs, and it will help you a lot. You need to have at least 2 recommendation letters. So minimum 2 recommendation letters, and you can upload an additional one. You can apply, you can upload 2 or 3, not more than 3, not less than 2. You need to also upload supplemental documents. This is optional, but if you provide some information, like for example, let's say I provided, I said that I did this publication, you need to upload that as a document. If you said that I was nominated for example, for the Dean's Honor List, you need to upload that as a document. And of course, you need to upload a digital photo in the website. For the recommendation letter, they have specific requirements. As mentioned, you need 2 recommendation letters. Depending on what you are currently doing, you need to have different sort of letters. They need to be officially headed, not on plain paper. You need to have the logo and, at least a logo for the hospital you acquired this or the university. Yeah, it's need to be an official paper. It needs to be signed and stamped. If you have the consultant or whatever the doctor, if they have the stamp, they can stamp. If they don't, they need to sign, and you need to stamp the paper from the hospital or the whatever department they are working in. This is very important. You need to, of course, include the full name of the referee, official designation, like he is, for example, American Board in Internal Medicine or consultant internal medicine, whatever, or whatever his designation is, his email and other contact details. They may contact him, not necessarily, but you need to provide a recommendation letter from someone that if you call him, if they call him or send him an email, he can reply and say, yes, I gave this recommendation letter to Iyas or Abdullah or whatever. The choice of the requirement for recommendation letter, if you are currently working or in internship or in another residency program, you need one letter from your immediate supervisor or the program director if you have residency. The second letter can be from any other consultant you worked with, including doctors from the university. For those who are not currently working, it means you finished internship, you are still not working, you need, the first letter needs to be a dean letter from your university. It is something that most universities do provide. Our university, they provide it if you ask for it. Not sure about yours, you can arrange for that. So it is something easy. Currently, they call it the medical student performance evaluation. This is something I think they are also using for the US, so the term can be familiar to the dean of your college. The second letter can be from any consultant you worked with him, for example, in the internship or in the university. It can be sufficient. However, as I mentioned, it is very important to provide a recommendation letter from someone you have already worked with before and he knows you well, If they communicate with him, he needs to answer, yes, I recommend Iyas or whatever. So for the application process, the application period, as mentioned, opens in specific dates. You will complete your profile and upload all your documents. Then you can submit your application. Make sure to submit before the deadline, otherwise it's going to be not accepted. You will after the submission, you will receive a confirmation email that you already submitted. This is an electronic message automatically to confirm your registration. Then the application will be reviewed by the program, and then they will choose those whom they will interview. They will send you an email that you are shortlisted for the interview. They will send you the link for the interview and the dates, and then they will interview you. They will rank the applicants based on the performance in the portfolio as well as the interview. They will send the results by email. They will either say you are provisionally accepted, you are waitlisted, or not accepted. Waitlisted means that if they accepted the number of people they wanted to accept. If someone who was accepted, he canceled the application, for example, he was accepted for Hamad Medical Corporation and the US, and he prefers the US, and he canceled, then they will allow for waitlisted people. They will automatically send you an email depending on your rank. So they will, for example, they have 10 seats. Number 10 was all of the 10 9 of the 10 accepted, and number 10 he did not accept. He wants to go to the US, for example, and you are number 11. They will send you an email that you are accepted already. This is after you have already done your interview, you have already done your everything. So they already, gave you some waitlisting, but then, you are still not ranking among the number of seats. After your provisional acceptance, you need to reply that yes, accept, or reject if you have another, for example, program. Then you will complete the recruitment process, verification of your documents, issuance of work visa in Qatar, license in Qatar. They will do your contract, etc. And then you will start residency in the 1st of July, the joining date for all residents in Hamad, as well as the US, I believe. So I know we took a lot of time. There are only a couple of slides left. So now I have finished everything mostly from whatever mentioned in the websites. This is from my own experience and observations. So these are tips for a better application in order to boost your application for a higher chance of acceptance. If you finished already internship, I would highly encourage getting a work experience in the same field that you want to apply to. So for example, I did 3 years of internal medicine work. It's not residency program, but it is, my job description was internal medicine resident in Dr. Sulaiman Habib Hospital before applying. It is not necessary. I know fresh graduates who didn't have any work experience who were accepted, but if you are older, you need at least to have at least 1 year of experience in the same field. If you are applying for family medicine, GP can work. If you are applying for pediatrics, pediatric experience can work, and so on. Some people can take clinical attachment in Hamad Medical Corporation. If you can take that, go for it. If you can't, then it's not necessary. I didn't land in Qatar actually, even before getting my application, so it's not something mandatory. The issue is regarding clinical attachment and internship in Hamad. You need to have an iqama in Qatar in order to get, or at least your parents, if your parents live in Qatar and you have a visit visa, you can apply for that, I believe. But it is a requirement that you are legally resident in Qatar or a legal visitor in Qatar before you apply to the clinical attachment or internship. If you can attend a conference in Qatar in the field that you are applying to and meet, for example, with the residents, fellows, program director, most importantly, make connections, promote yourself, it can help. There are lots of conferences in Qatar. In Hamad Medical Corporation, you can enter the website of Hamad Medical Corporation, and you can see the calendar. They have some events, for example, the International Internal Medicine Conference in Qatar. You can join that and meet with people, introduce yourself, etc. Good exam marks are an important factor. For the iPhone, it depends from specialty to specialty, but I would say target at least 90 plus, 90 out of 100. So for iPhone, 90 plus, look for the equivalent in USMLE. You can still get accepted if less than 90, so don't be discouraged. However, try to have the mark as close as possible to 90 in iPhone. There is no clear-cut rule. I know some people who got 85 and accepted in a very competitive program, especially for local graduates, of course. But for international, I think you need a very good result. Your recommendation letters, I advise that you have high quality recommendation letters specified to you. I know a lot of people will get recommendation letters in internship. It's going to be a template for all people. All people have the same. So no, ask your consultant or doctor to write you a personalized recommendation letter, if possible, and I think it is wise to get your recommendation letter from a doctor in the same field you are applying to. For example, you apply to internal medicine, get from internal medicine. Don't get surgery and to apply to internal medicine. The second thing, if you can get a recommendation from a well-known doctor in this field, it is also helpful. Like, for example, if you get a recommendation letter from the program director of internal medicine in King Fahd Medical City, for example, I think this is going to be a better recommendation letter compared to some recommendation letter from an unknown internal medicine consultant. Although both can work, don't be discouraged. I did not get a recommendation letter from program directors. I got it from my, of course, line manager when I was working as an internal medicine resident. I got also I got 3 recommendation letters. One of them, which is a must, needs to be from your manager, and not the doctor responsible for you, your supervisor. So this is going to be the department head. I got the 2. One of the doctors had UK what have done the specialty in the UK. The second one has done the specialty in the US. So I believe that my recommendations letters were of high quality from decent consultants. For the personal statement or intent letter, writing a unique and excellent intent letter or personal statement is key. It is very important. Show the program why they need to accept you. Not only that, it's a requirement, I need to write, like, for example, 500 words, and that's it. No. Take your time. Even if you need, get your personal statement or intent letter reviewed by someone who is, used to this application to the US or application to Qatar. Convince the program that they want to take you. Okay. If you have research experience on publications, this is also good. Try to have at least one publication. The more, the better. And most importantly, it needs to be at least similar or near the field that you are applying to. Participate in quality improvement projects if you can. Quality improvement project is something that is, encouraged in clinical practice all over the world. They do appreciate it in Qatar. So if you can do that, mostly it is done in hospitals. So ask your hospital if you are doing internship or you are working, how can I participate in quality improvement project? Get a letter from someone in this project that you participated. It's going to boost your application. I did also have this point in my application. Your CV should be rich and well made, including the visual look. For Hamad Medical Corporation, they don't have a template. You can do whatever you want. in the style. However, for Sidra, they have a template. You cannot use your own design. So, but the content of it should be well. Get it revised by someone who is in the medical field before applying. This is my advice. If you have courses like BLS, ACLS, whatever, something related to medical education research, this can help as well. Medical volunteering can help. Presenting in a conference or poster presentation also can help. Try if, like, for example, you can present in Qatar. This is also something that's going to boost your application. They do accept poster presentations from outside. So follow the website as I mentioned. And if you have something to present, it's going to be good. Honors and awards, including Dean's Honor List, Research Award, Poster Award, whatever, will boost your application as well. If you have the Dean Honor List, put it. If you have an appreciation letter from the hospital, put it, etc. Any additional point in your CV will help as well. I know that for people pursuing the residency program in Saudi Arabia, they have a good knowledge of how to improve your CV. So work on that. It will work all over the world, actually. These points are in general for all applications. However, my observation that these points are important for the not important. I mean, they will boost your application. So only 3 slides remaining. For the interview, in general, it is 10 to 15 minutes. It is done online for international medical graduates using Microsoft Teams. It is in English in general. However, if the program requires Arabic competency, they may ask you in Arabic. So be prepared for that if you are not Arab. If you are Arab, they will not ask you to speak in Arabic. They will speak with you in English. It depends on the situation. I know someone who had the interview done in Arabic, even though he is an excellent Arabic, he's having the native Arabic speaker, as well as his program was not requiring Arabic, but this is what they preferred. They will ask you for sure, talk about yourself in 1 to 2 minutes, prepare your answer well. This is the first impression that you will get of you. So prepare your answer. Don't show that you are, memorizing. This is, no. Try to make the introduction about yourself in a way that is fluent and not, don't make it seem that you are memorizing something and you're spelling it out. They will ask you about your experience if you have, or what are you currently doing? What do you want to do? Why do you want to leave your current role if you are, for example, doing residency in somewhere else? Some people will ask medical questions. I got asked a medical question. Some people will not be asked, depends on the interviewer. They will also ask you to talk about your research and publications. They will ask about inequality proving projects. They will not ask you, do you have or not? They will see your CV and they will ask you to talk about your research, talk about your publication, what is the outcome, why did you do this, what was your role in the research, etc. They will ask you in general, they may ask you, why are you applying to this program? Try to prepare an answer for that. They will ask definitely, do you want to apply to the US? And if not, they will ask you, why didn't you want to apply to the US? Especially if you have the USMLE. So if you have a USMLE, prepare your answer well. This will make you or break your application. If they say, I want to go to the US, they will say, sorry, we don't want you. So prepare an answer. I know you might be applying to the US, but try to get a diplomatic answer. And don't just frankly say, no, I am pursuing the US route. And this is my second choice. Don't ever say that. In the end, they will ask you to, if you have any questions for them. So prepare your answer for that question. In general, this is some general advice, additional advice for an interview. Make sure that you have a good internet connection. They are using generally Microsoft Teams. So try to get a call through Microsoft Teams the day before the interview to make sure everything is smooth and well. Even though it's going to be an online interview, dress well. Don't just, pretend that this is an actual interview. You are sitting in front of the person. Dress as if you are going physically to the interview. Prepare what you want to answer if they ask you to talk about yourself. Be calm, confident during the interview. There's nothing to be stressed about. I know it is difficult. I have been there too, but try your best. And in the end, when they ask you, do you have any questions for us? Don't say no, thank you, I know everything. No, try to prepare 1 or 2 questions. This can be either by reading about the program or reading about the interviewers beforehand. Go to their LinkedIn page if they have. Go to their research work. Ask them if, for example, you find a similar interest between your research and their research, etc. And in the end, because now Sidra and Hamad Medical Corporation are separate applications, they may ask you in your application if you are doing both. Are you applying to Sidra and Hamad Medical Corporation? So prepare your answer well for that question. Extra notes for your application. This is the last slide. Make sure to go back to the websites and read the full information. Maybe I presented something in a way that was not very clear, or there are extra details in the application websites. So go to the websites by yourself if you are interested. Read fully and understand what they want exactly. Prepare yourself well. All your documents must be available and valid. Okay, your exam needs to be valid. Your passport needs to be valid. I would say try to have it at least 1 year valid after the application, so that when they accept you, you can get the visa without delays. So if it is possible to renew your passport, make sure it's not expiring. All the dates mentioned in the presentation are subject to change. I know I mentioned some dates, especially for the iPhone exam and the application dates. Go to the websites when appropriate and update yourself about the dates. So this is very important. Never copy paste anything from the internet or from other people. They do plagiarism checks, so avoid that. In addition, now that we are in the era of AI, doing your whatever recommendation letter or letter of intent from ChatGPT or Copilot, I discourage it. You can get ideas either from the internet or AI, but certainly don't copy from AI. They do check for AI generated text, even if it is done, after that. If you do humanize AI or whatever, they will discover that. Don't do that. Okay. What else? So also, it is very important not to mention any false information in your application. Honesty is key. Be honest. If you have done something, say, write it in your application. If you didn't do it, don't write it. If they discover at any point, even just before you land in Qatar, that some of the information that you provided is wrong, they will disqualify you from the application. Even if you arrive in Qatar and they discover that your application had something that led to acceptance that is false, they may terminate you. So be very careful. This is not only for the acceptance, this is also honesty from yourself. And, having been disqualified for this specific reason is not something good. And if you apply, inshallah, check your email regularly. It is very, very, very important. All communication will be through email. So they will send the acceptance through email, interview date through email, everything will be through email. So follow your email regularly. Make sure to use an accessible email that you access daily to see any update. You may receive the acceptance letter at any time. There's no specified date for acceptance. They will not announce it beforehand. You will get it on time. You will have 1 week period to accept or reject. So if this period passes, it means that you rejected the application, and your application, although you got accepted, is gonna be invalid. These are some of the important links. I will share the slides with Dr. Maria after we finish, so you can click on the websites whenever you want. Go through the websites and review, as I mentioned. Time for the Q&A session. Sorry, I took a long time. I hope that was helpful and beneficial. I am open to any questions. For the timing, for me, I am flexible. I don't mind any length of Q&A session as long as we finish before 12. So whatever suits you, I am ready and I am here. So thank you so much.
Wonderful. Thank you very much, Dr. Mustafa. We really appreciate your time speaking with us today, providing incredible resources and your first-hand experience. So for your convenience, inshallah, I'll be reading out the questions out loud. And let's designate, inshallah, approximately 20 minutes. Inshallah, we'll not exceed that amount. We
No
appreciate
problem.
your consideration.
No
Okay, so there
problem.
was a question regarding the field of obstetrics and gynecology specifically. They were asking how many residency programs are you aware of in particular? I believe in the early slides you've mentioned a table with the total amount of seats, if I'm correct.
Yeah. So as I mentioned, application to Hamad Medical Corporation is one application. You apply, and for all programs, it is managed by Hamad Medical Corporation. There is no other programs in Qatar that do residency for OBGYN except for Hamad Medical Corporation. The number of seats, unfortunately last year they did not designate any seat for international medical graduates, non-local, non-Qatari. They accepted non-Qatari, but from graduates from Qatar University and Weill Cornell Medicine in Qatar. However, don't be discouraged. They will announce this year's intake on the 24th of October. So by that time, open the website. They will announce how many seats they will have for this year intake. It may change this year. They may accept next year. They may accept. It depends. So don't be discouraged. You can still apply. It is risky if you have other options. If if you say, I only want OBGYN, nothing else is suitable for me, like if you get accepted in internal medicine, you will not come, then you can try and apply. However, don't make it your only way of or pathway that you are pursuing. So best of
Wonderful
luck.
response.
Yeah.
Okay, next question. Regarding applying for residency in the US after completing residency at HMC, are
Yeah.
USMLE exams required? So for
Yes.
fellowship, basically.
Yes.
Okay.
It is required to have USMLE. Most people either they will have completed the USMLE exams before and they use them for application in Qatar. Other people they did the exams during residency. It is doable. Yeah.
Are GCC citizens also considered as IMGs in Qatar?
Yes. Except if they have Qatari mothers, this is different. But for people who have Qatari mothers and they are, for example, Saudi or Kuwaiti or whatever, they are among category 1 applicants. Or if they studied in Qatar. If you study in Qatar, this is different. Category 1.
Okay.
If you study outside Qatar and you are not Qatari, even if you are Saudi or whatever, they are not.
All right. And what about non-Arab speaking IMGs? What are the
Yeah.
chances to get into residency?
Very good. I know a lot of people who are accepted. Only 4 or 5 programs do require Arabic speaking. If you can speak Arabic with patients, you don't have to be perfect. Even if you can speak and understand, they will accept. These programs: internal medicine, family medicine, neurology, urology, and psychiatry. So only these programs
Wonderful.
do require Arabic. But I
Wonderful.
know people who are non-Arab and accepted. So as long as you can converse with people in Arabic, even if not perfect, it's fine.
Great. And what's the minimum GPA that they accept?
No minimum GPA. The higher the better, of course, but no minimum GPA. You can apply
Okay.
to the GPA.
Is it fine to wear niqab, the facial covering, in hospitals or even
Yes.
during surgeries in the OR?
I'm not sure about surgery, to be honest. I think it is. A lot of doctors who work with us wear niqab, so it's fine. No worries. Don't worry about it.
Wonderful. Alhamdulillah, like you mentioned, the benefit of practicing in a Muslim country, alhamdulillah.
Yeah,
The medical
of course.
license from the country of graduation, how to know if it's valid in Qatar? So basically, if someone's graduated from a country and they've attained the medical license from that country, how can they check to make sure that it's um, basically recognized in Qatar as well?
Can you clarify the question? Is it for application for residency
For
or
application,
work?
yes. So I assume it is after internship and after they did the licensing exam of that country that they've graduated from,
Yeah,
they now
yeah,
want to go and do residency in Qatar. So how can they check
yeah.
and make sure that it's valid in Qatar?
If you have any medical license in your country is valid, they don't require because you will have to apply for a medical license in Qatar, and they will do that for you. So don't worry. As long as you have the license in your country that you are working in, if you are working in Saudi Arabia, Kuwait, India, Iraq, whatever, if you have a license, you can get it. They only require, I think, I'm not sure if they require this paper or not. They will require it. The letter of good standing, they issue it from the Saudi Council and other councils, so it's easy. And this is something that you will get. The letter of good
Wonderful.
standing from the license and the license
Okay,
itself.
excellent. And does it affect my acceptance next year if I didn't match or if I was rejected before? So basically, someone's applied to Qatar before previously, but they for some reason didn't match into the specialty of their choice, or they were simply rejected. Will that hinder the acceptance for the upcoming year?
No. I know one of my colleagues in internal medicine in my batch, the year before he applied to radiology and he did not get accepted. And next year he applied to internal medicine and he got accepted. So no problem.
Wonderful.
Yeah.
Regarding radiology oncology acceptance, uh,
Yeah.
even though it's competitive, what are the bare minimum requirements?
You mean radiological oncology? Radiation
Yes,
oncology?
radiological oncology. Yes, if it's your knowledge.
I'm not sure, to be honest.
Mm.
I don't have any connections in that department. But yeah,
I was,
it's similar. It's
yeah,
not a highly competitive field because I know that seats are very limited, but it is not ACGMEI accredited, so the competitiveness might be a little bit less.
absolutely. And I would recommend for those who want that specialty in particular, find doctors of that specialty who have matched successfully in Qatar and ask them, inshallah, hopefully they can give you some good tips.
Yeah.
But if you want internal medicine, we've got our internal medicine resident here, mashallah. All right. And does clinical attachment count as practice to cover the gap year?
Um, I would say yes and no. It's better than nothing, but aim for something better.
Okay. So professional work experience, inshallah.
Yeah.
Is one exam preferred over the others when applying? So they're referring to IFOM, USMLE, steps, etc.
Yeah. It's a debatable question. I think I answered in the presentation. The short answer is no.
Yes.
The higher mark is more important.
Okay. And
And I got accepted by iPhone, so it's okay.
alhamdulillah, yes. And like you said, that is the best option for time and convenience, etc.
Yeah.
Okay, where can we know about conferences happening in Qatar? So Dr. Iyas
Uh,
mentioned this in the presentation. You can go to the website. Which website was it again, Doctor?
it's the Hamad Medical Corporation. Just Google Hamad Medical Corporation, and you will have the calendar of events. They will announce the conferences there. I think they do announce on these on social media platforms, but it's gonna be delayed. The most updated is the calendar on the website. And
Brilliant.
of course, if you know someone, you may ask them to share. If, like for example, you know someone who is working in internal medicine or surgery or OBGYN, you can ask them to share whatever conferences with you.
Excellent. And um, does research and medical conferences help in getting accepted?
Yes.
Like you've mentioned, yes. Okay, so regarding the letter of recommendation, the immediate supervisor for interns,
Hmm.
or are you referring to the supervisor in charge of that specific rotation that the intern is aiming for? Which one were you referring to in terms of a letter of recommendation from the internship supervisor?
Okay, so they do not specify, to be honest. However, I believe it's going to be either the program director, or, for example, well, I remember in internship, we had a doctor who is responsible for interns in each department. So the program director for interns or the program director of the residency for that specific rotation is the one. Yeah, I think that's
Great.
Or if someone from your university is directing, who is a doctor, if he is directing the university internship program, if you have that person who is a doctor, he can get you the recommendation, I believe. But
Brilliant.
try to have it from someone who is working in the hospital that you are working at.
Okay, inshallah. What about GPA and board exam percentages to match? So I assume they're just
Which one?
asking a broad question. The GPA and the board exam percentage. I assume they mean the
There's
bare minimum.
yeah,
Yeah, which you've
I
touched on already.
Yeah, I think this question rises from the like in Saudi Arabia residency programs. There is a percentage for the exam for the GPA and a percentage for the SMLA. There's no percentage. It's just gonna be marks. So
Of
each one is
course.
counted separately.
Understood. So it's not counted and then taken as an average, for example. It's just individually.
GPA, I would say, yeah, I would say if your GPA is above 4, it's safe, a 4 out of 5. Below that, don't be discouraged again. But if you are still studying, aim for more than 4 or more than 4.5 out of 5. If you already graduated, your mark is not like just less, or if it is above, don't worry. For for iPhone or step 2, for iPhone, as I mentioned, aim for 90 plus. Don't be discouraged if less, but if you can improve your score, do that. For USMLE, I'm not sure about the results, to be honest, but there is in the iPhone website there is a table for equivalent marks between the two, so you can see the equivalent mark for 90 in the USMLE and aim for that. For GPA out of 4, I think it's gonna be 3 out of 5. 3 out of 4,
Okay.
sorry.
Yeah. Um, Now that is, inshallah, hopefully decent. However, if a person was to have a lower GPA than that, you said don't be discouraged, but what's
Yeah.
the lowest GPA that you've ever heard of being accepted?
I don't know, to be honest. I didn't ask, but I don't usually ask my colleagues about GPA. There's no clear-cut point.
I
I
guess
mean,
just
the higher the better.
hope for the
Yeah,
best, inshallah. Yeah, the higher the better. Aim
yeah.
as
If
far
if
and
you
wide
are
as you can.
if you are still a student, aim for the highest GPA that you can. If you are a graduate, this is your GPA. Use it to apply. There's no clear, guidance on how it will affect. If you have a lower GPA, I would try to, boost your CV in other areas, do research, do quality projects, do, publications,
Conferences.
conferences,
Yeah.
etc. And I think you will have not all of our, I'm sure that not all of the residents who are accepted in Hamad Medical Corporation have, brilliant GPAs. But yeah, if you are a student, get a 5 out of 5 or 4 out of 4. If you are a student, if you graduated, then that's it.
Wonderful advice, Doctor. Once again, we really appreciate your time. I always say,
Yes,
don't let
okay.
your GPA define you.
Of
Try
course,
and
yeah.
be a well-rounded applicant, and like you said, focus on other areas and try and sharpen your strengths. And hope for the best, inshallah. And don't be discouraged from trying.
Yeah, of course.
There's one
Yeah.
more question regarding
Sure.
recommendation letters. What about to work as so? If you were to work, basically volunteering recommendation letters, are those also accepted?
Uh, I don't think so. You can put them in the application, but the required need to be regarding your work. If you worked with a consultant, for example, who was directing a volunteering program, and he will give you a recommendation as long as the letter is from a hospital and headed with the hospital and stamped by the consultant or the hospital medical education department or whatever department, it's fine. You can use it, but try to get a better one. It's not necessarily that you have, extensively worked with this recommendation letter giver. It is, of course, required that you have worked with him for some time, but not the timing may vary. It's fine. Even if you did one rotation with him, I think it's fine. So yeah, if you
Okay.
did
So that can
volunteering with
vary.
him, yeah,
Yeah.
it can vary, but aim for someone who is in clinical practice.
Yeah, and who's currently active. Okay. One
Yeah.
more question, inshallah. Do they conduct interviews after the application period closes, or do they run them while the application period is still open?
Both.
Both. Okay.
But mostly after it closes. In some years, if the applicants if there's a large number of applicants, they may start interviewing before closing. So the earlier you apply, the better. But depends. It varies from year to year. For myself, I submitted my application just before the deadline by a couple of days. So it's not a hard and fast rule.
Wonderful. I think that's it. That wraps up our Q&A session, and that concludes our webinar. Thank you so much again for your time and consideration, for agreeing to do this, Doctor. This is an incredible session of yours, and may Allah count it as Sadaqah al-Jariyah on your behalf, inshallah, and Zakat al-Ilm. And this recording will be available, inshallah, on all our social media platforms. So stay tuned, everyone. I'll also be sharing the slides. Doctor, inshallah, we'll be in contact. Thank you so much once again. Have a wonderful evening.
Thank you for having me, and I hope that this was helpful and beneficial and that you enjoyed it.
Jazakallah khair, Doctor. And inshallah, we may meet one day in Qatar. Why not?
Why not? Yeah.
All right, Jazakallah khair. Thank you
Inshallah.
everyone for joining.
Best of
Have a
luck for
wonderful night,
everyone.
inshallah.
Thank you so
Jazakallah
much.
khair.
Yeah.